going to ask Dr. Raymond to join us here as we were talking about the implications from returning to work, how people work, the legal implications of it, and want to see if we can get Dr. Raymond to join us here and talk a little bit about some of the health considerations.
Thanks, Tim, and good morning, everyone. And thanks, Irina and Mark. That was really an interesting presentation. If I could ask Chris to put the slides up and go to the first data slide, please. Thanks. I wanted to start by saying that we have mostly promising trends to report with a few cautionary notes, but I want to focus on as much as possible on the positive notes. So we only had 205 cases reported in Wisconsin yesterday. That's part of a downward trend that we've seen for the last month in terms of reported cases. We had plateaued for a few weeks, but it's fairly clear now that we're very slowly trending downward in new cases. And you can see that also reflected in a relatively low number of 59 reported in Milwaukee County yesterday. Also, our case positivity, although it remains higher than the 5% that we want, seems to be trending in a good direction. So 8.9% case positivity in Wisconsin yesterday for a 7-day average, 11.5%. Similar trends in Milwaukee. That would suggest to me that the undiagnosed burden of disease in our community may be trending downward, which is good news. Next slide, please. Thank you. Having said that, we are approaching 7,000 COVID-19 related deaths in Wisconsin and over 1,300 in Milwaukee. And again, I always say that these are clinical and PCR confirmed COVID cases with deaths attributed to COVID-19 by the clinicians. In Milwaukee County, if you look at the Milwaukee County website, the number of COVID-19 deaths reported by the medical examiner is slightly lower. And as we've said many, many times, there is a slight predisposition for bad outcomes if you're male or if you're in a minority population, in particular, Black and African American, Hispanic and Latinx populations, as well as some Asian populations, have disproportionately bad outcomes from COVID-19. Next slide, please. On the theme of good news, we're actually doing quite well in terms of vaccinations in Wisconsin. You look on the left, we're at 44.4% of the entire population of Wisconsin having received at least one vaccine, and 37.4% having been fully vaccinated. Similar trends in Milwaukee on the right at 42% having had at least one vaccination and 35.1% fully vaccinated. And this is actually good news because Milwaukee County was lagging very significantly behind the rest of Wisconsin through January and February. And we're starting to catch up because of targeted efforts to address populations that have not had a good percentage of vaccinations, predominantly in Central City, Milwaukee. And there are many, many efforts to address vaccine hesitancy and to instill vaccine confidence throughout the region. And I think this is going to be important as we go forward, because despite the fact that we've done pretty well in terms of administering vaccines, we're running into a wall. In other words, there's plenty of supply now, which is different than in January and February, and not a lot of people that want to get vaccinated. So even though we're approaching 50% vaccination in the state, it's going to be difficult for us to get up to that 70 to 80% vaccination hurdle that many experts have said we need to get to achieve so-called herd immunity. And this is going to be something important for employers to focus on as we go forward, especially if we think about the things that we can do to resume normal activities. Next slide, please. Now, again, a relatively good story here. More than 1.3 billion doses of COVID-19 vaccines have been administered worldwide. That's about 13% of the total population. The US is first in the world for total vaccinations at 260 million, although China claims to also have administered about 260 million doses. The US has a higher percentage of individuals who've completed the series, 34%, than most of the rest of the world. We're behind Seychelles, although Seychelles is having a very significant problem with breakthrough infections, which has caused some to question the 61% vaccination number. Israel's been stalled, though, for the last few weeks at 56%, which again may be, and they're typically viewed as best in class right now. That may be the upper limits of what we can achieve without a concerted effort to address vaccine confidence. Chile is at 38%, San Marino and Bahrain at 37 and 35%. So we're doing better than the rest of the world. And I think in part, that's one of the reasons why we're starting to see some favorable trends. And good news here locally is Wisconsin remains in the top 10 of US states and territories in terms of the percentage of population fully vaccinated. And we're in the top dozen or so in terms of the percentage of population that have received at least one dose. Next slide, please. So some key takeaways. We have made significant progress against COVID-19 in the US and in Wisconsin. The 7-day average for new cases is 41,000, and that shows a decline of 30% over the last 2 weeks. US hospitalizations are also down 13% over the last 2 weeks at about 39,000. Having said that, those are still pretty big numbers, and we've got a ways to go. The US average daily deaths also are trending favorably, down 6% in the last 2 weeks to an average of about 667 per day. And remember, the deaths lag these other indicators by somewhere between 4 to 6 weeks. And the US is approaching vaccination of 50% of our population. 153 million people have received at least one dose in the US, and 116 million have been fully vaccinated. So this is a partial success story for us and something that I think reflects favorably on us. Vaccinations are starting to decline, but we continue to inch forward. As I mentioned, the vaccine supply does exceed the demand right now, and we are projected to fall short of the hopeful target of vaccinating 70–80% of our population. And daily vaccinations also are tailing off. They're down 37% since the peak that we experienced about 5 weeks ago. So we're running a little over 2 million doses per day in the US. Now, I want to focus on some hopeful news. 12 to 15-year-old adolescents will soon be eligible for vaccination, which would add nearly 5% of the population as eligible. And I want to make sure that people know that there are checks and balances in this approval process. So the FDA yesterday announced emergency use authorization for the Pfizer vaccine for 12 to 15-year-olds. And that was based on a recommendation of the Vaccine-Related Biological Products Advisory Committee of the FDA. And it was also authorized by the FDA director. Now, tomorrow, the CDC's Advisory Committee on Immunization Practices, which is a similar committee of health professionals, will advise the CDC director on whether to authorize the distribution and administration of the vaccine for 12 to 15-year-olds. Then after that, our Wisconsin Department of Health Services also needs to weigh in. They do have a vaccine advisory committee, the SDMAC. But I do expect, unless there's some twists that would surprise us, that by the end of the week or early next week, the 12 to 15-year-olds will be able to get a Pfizer jab here in Wisconsin. Also, some more hopeful news. I expect, and many other experts expect, that full FDA authorization for the Pfizer vaccine could happen in July. In other words, we'll move from emergency use authorization to full approval. And that's very promising for us. And I think it's one of the things that's been holding back some employers from considering mandatory vaccinations. It's also probably one of the factors that has contributed to a lack of vaccine confidence for maybe the movable middle of people that are still questioning the safety and efficacy of the vaccines. I also believe that children under 12 could be eligible for vaccination by autumn. There's a growing consensus that the Pfizer and Moderna vaccines could be authorized by the fall. And that also could be a game changer for us because that could bring another 10 to 12% of the population into eligibility. And more hopeful news. In the last 2 weeks, there have been studies that have been released that have shown fairly clearly for the Moderna and the Pfizer vaccines that there is pretty strong effectiveness against the currently circulating variants in the US. Not so much information is known about the emerging Indian variants, but the so-called UK, California, Brazil, and South African variants get pretty good coverage from the currently available vaccines in the US. So that's good news for us. If I can go to the next slide, please. So you've already heard some of these trends from Mark and Arena, but what could accelerate the return to the workplace? So I think addressing vaccine confidence in minority populations, young adults, and then for parents with kids is going to be important for us to reduce the burden of disease in our community and instill confidence in populations that are still questioning, and many of those would be our employees. We should try to make vaccines easier to administer. So moving from clinics where individuals need to come to you and making vaccines available in churches and neighborhood pharmacies, at community centers is going to be important next step for us to maybe get an extra 5 to 10% of the population vaccinated. This emergency use authorization for COVID-19 vaccines, at least starting with Pfizer, for children under 12 could be a game changer for us. And again, we expect this to happen in the autumn. And again, a variable that we really can't control, but we need to monitor and not take for granted is no breakthrough variants that would escape from vaccine immunity. And this is important because we know that the P1 variant in Brazil has already escaped from the immunity that people had from a previous infection, although there still does appear to be good coverage from vaccines. Full approval of Pfizer and other vaccines by the FDA, I anticipate that could happen by July. And then implementation of and acceptance of mandatory vaccination in the workplace, in schools, for travel, and certain other settings could make it easier for us actually to reach that herd immunity. But as Mark mentioned, and all of us know, we can expect some legal challenges, at least with some of the employers that want to be the first to market with mandatory vaccines. Next slide, please. And we've already touched on these. Going back to the workplace, some things are going to be different. I think most of us are going to have to be flexible in terms of our plans and also working arrangements for people that may be concerned about returning to the workplace. And we think returning to the workplace will occur in stages, and that's a responsible thing to do. Probably, at least in the short term, there'll be less travel, more virtual meetings. We may have the concept of hotel space for people that have hybrid work arrangements where they may come into work just for a short period of time each week. Dress code may change in some industries. I think we're all getting used to being more casual. And then just some questions. When are we going to be comfortable sharing food and coffee in the workplace? When will handshakes return as a norm for business? And I think all of us as employers need to be thinking about our HVAC, especially when cold weather returns in the fall and the winter, especially because we know that there are persistent aerosols that carry COVID-19 that we can't treat like large respiratory droplets by maintaining a 6-foot social distance. So these are just some things we need to think about. The next slide shows some data sources that we use for these presentations at MCW. And then there are other slides that talk a little bit about instilling vaccine confidence and some of the strategies that we're implementing here in Milwaukee to try to address that really important issue. And with that, I'll turn it back over to Tim.
Great. Thanks very much, Dr. Raymond. Again, an informative presentation and got a number of questions. So I'll jump right in on those. So the first one is there so much interest in combating the vaccine hesitancy that the side effects of the vaccine are being downplayed or not even being reported or publicized, thus causing undue anxiety among those experiencing the side effects?
Well, I certainly have heard that argument, but to be perfectly honest with you, I think these vaccines are being monitored more carefully than any other vaccines in history. And there is a vaccine reporting site that basically is like a tip line or hotline where people can call in and express potential concerns about vaccine side effects. And we've never had that before, and it's being very heavily utilized and actually mischaracterized in some cases for people to say that the vaccines have more side effects than they actually do. So there have never been there's never been a vaccine rollout with more public scrutiny than we're having right now.
Thank you. And then the question on 12 to 15-year-olds being vaccinated. If they get sick, they don't get that sick, and two, there's good evidence that this group does not transmit the virus readily. So I guess the question is, why should they get vaccinated?
Yeah, thank you for the question. And I actually think I'm going to have to disagree with some of the statements that were made. Kids under 10 are 50% less likely to transmit the virus. We're not sure why that is. But kids over 10 are at least as likely to transmit the virus to someone else as an adult. So we have to think about the age groups differently. And so it isn't right, and it may actually be dangerous to say that kids don't transmit the virus. They do. And over 10, it's the same as adults. So I think that's a really important consideration. And I think in part, it is important for us to get adolescents vaccinated as soon as possible if we really want to reach, this magical number that could allow us to start relaxing the behavioral interventions that we have.
Yeah, Dr. Raymond, you and I have talked about this in the sense of, does this become the new flu shot? So as you look out ahead, the question is, if you receive both shots, do you anticipate a booster coming? Does it make sense to get the booster? And as that happens, will we get this from our doctor, or will this, how will this roll out going forward?
Yeah, thanks, Tim. And before I mentioned that, I actually wanted to say one other thing about the previous question. It is not true that children don't get sick from COVID-19. What we're seeing as people over 65 have been vaccinated, the virus is finding new hosts, and most of the hospitalized patients are young, and most of the new cases are young. And we're seeing a change in the biology with these new variants that are spreading, where kids do get sick, and people in the 10 to 29-year-old age range are being hospitalized more. So I want to make sure, let's not be too casual about saying that. I just wanted to make sure that you said that. And Tim, can you
Sure. The question is, well, actually, while you answer that question, let me go to another one, because you're right in line here. And when do we start talking about this vaccine like other public health vaccinations, measles, mumps, rubella, tetanus, those kinds of things?
Okay.
And when do we start talking about it? Because we don't seem to get the same pushback on those.
Yeah, I think we're already starting to talk about it. I think it is very likely, since we're not going to eradicate COVID-19, it's going to be something that we'll be dealing with for a while, that it is likely we'll be getting annual boosters. And that may be because there is an emerging variant that doesn't get great coverage from the previous vaccinations, or it may be just to give ourselves a seasonal boost as there are peaks and surges of COVID-19. But as soon as we go to full approval and from emergency use authorization, we're going to have that conversation in earnest. And I do think with some of the vaccines that are less fragile and don't require the ultra cold chain storage, that it's going to be fairly routine for us to get these vaccines in doctors' offices and during our regular visits to our physicians and our health systems, maybe this year, but certainly next year. I think it'll be a routine thing.
Yeah, and interesting discussion again, Dr. Raymond, we had yesterday about this kind of plateauing in the US and maybe in some other places. And I thought you brought up a really good point I wanted you to share with the audience about this gives a toehold for these variants to come in.
It does. And I've said to a number of you, and we had a conversation about this, Tim. What's happening in India is very troubling, not just from a humanitarian standpoint, But the more cases or the more infections with COVID-19 that there are, the more likely it is that there will be new variants, new mutations that give the virus a competitive advantage, both in terms of being more contagious and maybe more severe. And again, I think you may be seeing some of that with the trend toward younger infections. So the sooner we get COVID-19 under control here and in the world, the more durable our immunity and these interventions that we have will be.
Mm-hmm. Can you talk about the relative effectiveness of Pfizer and Moderna versus J&J? I mean, at one point early on, you were telling me if you get a chance to get a shot, get a shot.
Yeah, I would still say that. They're all very effective for the things that matter, just in terms of producing or preventing severe disease, death, and hospitalizations. All three of the vaccines on the US market are extremely effective, over 90% effective. Because the J&J is a one-shot and different technology, it may be a little less effective at preventing asymptomatic or mildly symptomatic disease, but they're all really good vaccines.
Yeah. What would you say, Dr. Raymond, as somebody who has had COVID and then gotten one shot? I've heard a lot of people say, look, I had COVID, I got one shot. I don't want the side effects of the second shot. How protected are they, and how much of a reasonable answer is that?
Well, it's an open question, Tim.
Okay.
Certainly with one shot, you're going to get good protection. And if you already have some immunity from the previous infection, there is a school of thought that you might only need one shot, but the current recommendation is two. But I would say that it still remains an open question that we need to explore. If I had a previous infection, I would, and again, this is just me, I would get the second shot primarily because we know that the P1 or the Brazilian variant is pretty much not affected by a previous infection, that there's been breakthrough in that immunity. And because there is spread of P1 here and some of these other variants, I probably would be willing to have a day off work or a fever or a bad headache or a sore arm from that second shot. But that's me.
Okay. So what can you tell us about the frequency and severity of the neurological side effects that are being reported with Moderna?
Yeah, excellent question. And I think probably what people are most concerned about is Guillain-Barre syndrome or ascending paralysis, which is when the body's immune system attacks your nerves. So it causes muscle weakness and sometimes paralysis. This happens about 3,000 to 6,000 people per year in the US. And the most common association is actually with an infection, not with vaccines. So this is relatively rare. And it happens primarily in people over 50. And there have been links of Guillain-Barre syndrome to the flu vaccine, in particular, the swine flu vaccine in 1976, where there was estimated to be an extra case per 100,000 people that got the swine flu vaccine. In follow-up studies, it looks like there is an extra 1 to 2 cases per million with the seasonal influenza vaccine. Again, it's hard to ascribe cause and effect when you have such a rare side effect. So there have been a few cases reported after people have gotten the Moderna vaccine, not enough for us to say that there is a definite link. And what I think is fair to say is the links to an infection and probably COVID-19 are probably clearer than the links to the vaccine, but this is an emerging area that requires our attention.
Yeah. So as we think again about the 12 to 15-year-old population, the question is, do we anticipate the clinics like the Wisconsin Center and other places that have been open to the public now to stay open given the higher demand that could come from that?
Maybe, but again, I think all of us are trying to incorporate the COVID-19 vaccination into the regular cadence of healthcare.
Okay.
And my guess is by the summer, you're not going to see mass vaccination clinics except in areas where people have difficulty getting to a doctor, and that this is going to be more commonly administered in pediatric clinics or a children's hospital.
So let me wrap up with one final question for you, Dr. Raymond, and ask you to think ahead a little bit, which is always challenging with this topic. But it's September. I'm an employer. I want my employees to come back to work. What are the 3 or 4 factors I should consider in kind of making that request for employees to come back to the office?
Yeah, great question, Tim. And there's always going to be some judgment involved. The things that I think are important would be, what is the percentage of vaccination in your community? If you know, what is the percentage of vaccination amongst your employees? How closely are they going to need to work together? Obviously, that's industry specific. And then something that I don't hear people talk about very often is, what's the burden of disease in your community? And one thing that I want to remind people of is, we're all eager to try to get back to work. The burden of disease in 68 of Wisconsin's counties right now is high. The burden of disease in 2 counties is very high. So in 70 of our 72 counties, the opportunity for you to get exposed through incidental contact with others still remains high. So I would feel much more confident in September if we had a trajectory that was declining and we have low burden of disease in our communities about getting back to work. So those are some things that employers probably should pay attention to. And then always, Tim, we talk about the wild card here is variants and the emergence of new variants in India, and whether that's going to have an impact on us here a couple months down the road.
Great. Dr. Raymond, again, thank you for your time. You're always so gracious to join us, and I think it's really helpful information across the board. And to Mark and Irina, thank you again for your expertise and time as we start to move through the summer and hopefully get to more openings in the fall. You've all been very informative and gracious, and we're appreciative of it. So have a good rest of your afternoon. And again, if you want your Dr. Raymond fix, you can listen on WTMJ this afternoon at 4:20. And again, have a good day and thank you.